The future of healthcare is freedom. Freedom from networks, red tape, and outdated insurance. The people who are going to thrive the longest are the ones who can separate their healthcare from their health insurance. But right now, most of y'all are still trapped in a system designed for sickness, not health. Let me guess. You finally found a doctor that understands optimization and longevity, but they don't take your insurance. So you pay cash for functional and concierge medicine. You know you need health insurance, but paying for something useless feels insane. Dropping it feels reckless. It's like the only way for you to get any value from your health insurance is for you to be sick. Because that's how the system works, right? It rewards sickness. This is why we need to reframe how we view healthcare and insurance. Healthcare should be personal, data-driven, proactive, based on your biology. Instead, we were handed a system decades ago that was designed to manage sickness. Do you see the difference? Insurance was created for catastrophe. We need to start thinking about it as our stop loss. When you separate your insurance from your healthcare, you finally take control of your health. I've seen how broken this system is firsthand, and that is why I created the Total Protection Plan. But before we go any further, what's up? I'm Alexa, and I've spent the past 8 years helping entrepreneurs and business owners design health insurance plans that actually pay your medical bills. We are a full-service firm offering health and life insurance, employee benefits, and an advanced planning team, all working together to protect everything you've built. And after helping so many people piece these parts together, what I've realized is that successful business owners want the same thing from their health insurance strategy that they want from their business: clarity, control, and efficiency. And that's what led me to build the Total Protection Plan, a complete 4-layer system designed to protect every part of your health and your income. Here's how it works. Layer 1 is your catastrophic major medical insurance. This is your foundation. Think of it as your stop loss. This is the part that protects you when something major happens. Hospital stays, surgeries, 6-figure medical bills, all covered. Next is your living benefits. This is the second most important layer of your plan, because when you hear the words "it's cancer" or "you've had a stroke," everything stops. And that is when this policy steps in, paying up to $1 million directly to you. That way you can focus on staying alive, not staying afloat. Layer 3 is your accident coverage. This handles the smaller emergencies that still cost thousands. If you get hurt, whether you fall off a roof, slice your finger in the kitchen cutting a tomato, your daughter tears her ACL playing soccer, you pay nothing. Your accident plan steps in and eliminates your deductible for you. Any visit labeled as an injury is fully covered. And the last part of the Total Protection Plan is how you get personalized, on-demand healthcare without the insurance chaos. This is a healthcare concierge membership that gives you access to unlimited telehealth visits, your prescriptions covered at $0, and most importantly, access to $0 diagnostic lab work through our exclusive contracts with Quest Diagnostic and LabCorp. This is everything that would be subject to deductible. You want to test your hormones, your gut health, your biomarkers. It is all included in your membership. You pay nothing. Once you understand how the Total Protection Plan works, your next step is figuring out how it fits in your life. Below this video, there's a button for you to click to schedule your protection strategy session. We'll take a look at what you have right now, highlight what's working and what's not, and show you how to optimize both what you're paying and how you're using your plan. But before you click that button, let me ask you a question. What would it mean for you if you didn't have to worry about a deductible or networks? If the care you actually wanted was just covered, point blank. It is 2026. Healthcare should be data-driven, personalized, and not gate-kept by your deductible. And while that's how we plan to help you stay healthy, the other half of your Total Protection Plan is built for when life blindsides you. Here's what that looks like in real life. Last 4th of July, one of my clients, Miss Patty, broke her arm jumping into a swimming pool. Her major medical plan paid for her surgery, and her accident plan eliminated her deductible, so she didn't have to pay anything. But after the surgery, her doctors were like, it doesn't make sense that your arm broke just from the impact of the water. Like, that shouldn't happen. So they ran tests, and later that day, my client, Miss Patty, was diagnosed with stage 4 breast cancer that had metastasized to her bones. After that diagnosis is when her living benefits policy stepped in, paying $1 million tax-free directly to her in a check. When you access your living benefit funds, you can use the money however you need to pay your mortgage, cover medical bills. You can buy a boat. It is your money. It's been 1.5 years and Miss Patty is still fighting. And because of her living benefits plan, she's been able to focus on recovery, focus on her treatment, and spending time with her family without worrying about medical bills. On the worst day of your life, the last thing you should be worrying about is how to pay for it. When you schedule a protection strategy session, we'll show you how these benefits integrate into your current plan. That way you're not paying twice. You're covering the gaps that actually matter. Now, here's the thing. These plans only work before you need them. Once something happens to your health, your options shrink fast. If you wait until a health scare to make a change, it's probably already too late. Health insurance sucks. We help you find the insurance that sucks the least for you. If you're ready to take control of your health, schedule a protection strategy session. My team will help you compare every plan in your area, review your prescriptions and doctors, and make sure you have a total protection plan in place. That way you are prepared no matter what happens. Click the link below to fill out the form, and we will text you to schedule your one-on-one appointment. Let me know if you have any questions down in the comments below, and I will see you next time.